Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Welcome to the Taylor Method for Pain-Free Living podcast. My name is Dr. Hudson Taylor, and here today with us we have Dr. Karima Hirani. She's back on the show. Tune in to the first episode with Dr. Hirani, where we talk all about her journey, why she does what she does. She is a medical doctor and holistic practitioner. She's also a nutritionist, and she specializes in so many different therapies, both medical and holistically natural. But today we're going to discuss one therapy in particular, and that is called stellate therapy, a stellate injection. And we're going to talk all about that today, because let me tell you, she treated me, Dr. Hirani treated me with that a couple weeks ago. And let me tell you, it has made a huge impact on my health. And we're gonna really dive deep into that. So Dr. Hirani, thanks for being back on the show today. I wanted to ask you, what is exactly the stellate injection? And, we'll start with that. What is it?
Okay, so the stellate ganglion is basically a bundle of nerves that sits along the sympathetic chain that kind of goes up to the brain. The sympathetic chain is part of the autonomic nervous system, and the autonomic nervous system, in layman's terms, consists of two parts. There's the parasympathetic, which triggers rest and repair for the body, and then there's the sympathetic, which triggers fight or flight, and it's the stress response. So the stellate sits in the sympathetic nervous system, and it sits in the sympathetic chain of nerves that goes up to the brain. So as you know, in modern day and age, we're constantly in this stress response, instead of being kind of like in the olden days where we only kick in the stress response, the fight or flight response, when we're being attacked by a predator, like an animal. But unfortunately, in this day and age, we're constantly in this fight or flight, which is not a natural state. But unfortunately, it has become a natural state for most people, and they don't even know what it means to be in a rest and repair state, because they're just in a constant fight or flight. So the stellate block, which is what we do, it's done through ultrasound guidance with a specialist. And like I said, it sits in the neck, and it's done very safely in the hands of a trained expert under ultrasound guidance. And originally it was discovered in 1920 And because it it's resetting the autonomic nervous system, it's blocking, it's basically doing a block. We're blocking those signals that are going up to the brain. So the treatment is not really is not necessarily going into the brain, but the treatment is going here and blocking those signals that go to the brain. And so 100 years ago, it was the anesthetic that was used was Novocaine or Procaine, which we've talked about neural therapy last time. And neural therapy is all about resetting the autonomic nervous system. This is a reset of your autonomic nervous system. I call it the ultimate neural therapy treatment. The Novocaine is a short-acting anesthetic, and it's great for the regular neural therapy that I do and that we talked about last time. But the stellate block requires a long-acting anesthetic because we want to literally change the brain biochemistry by blocking the stellate for about 8 hours. And so it's a long-acting anesthetic that we use instead of the short-acting, which is the Novocaine. And by blocking for 8 hours, those signals that are constantly, because we are in constant fight or flight mode, like I said, we've become so accustomed to being in this mode that we don't even know that this is not a natural state that we're in. You know, we just no idea what it means to be in a state of rest and repair. So by blocking the signal to the brain, we're allowing the parasympathetic nervous system to sort of come into balance, and the results can be phenomenal. I would be lying to you if I said that everybody who gets the injection derives benefit, and that's not true. Some people require more than one treatment, and we tell them that if you didn't get results with, say, the right side, then come back again and we'll do the left side, because about 30% of patients who don't get benefit from one side will get benefit when we do the other side. We can't do both treatments on the same day. We have to have at least 24 hours between doing one side and the other. It's just safer that way. Nobody ever blocks, both on the same day. And then for some people, it can be so dramatic that they don't realize, like it can be very emotional, and neural therapy has a tendency to bring up emotions. So if you've stored a lot of emotions that are, causing PTSD. So most of the research in stellate ganglion block recently has been in PTSD Army vets. So about 5% of the VAs offer the stellate ganglion block. I wish
Incredible.
There were more
VAs
that were offering it. And maybe once I get, fully trained and fully comfortable doing it myself, maybe I'll go and like offer it,
pioneer that.
To the military vets.
Absolutely.
So there's a lot of research in, recently in the military. And so what I do is I have patients fill out a questionnaire and to see if they fit the criteria for diagnosing them as PTSD. And a lot of my patients, sadly, have PTSD and they don't even know it. Last month when you came, I had another gentleman who has a very, very busy, he's self-employed, he's a paralegal, very, very busy practice, very successful, young guy, a little bit older than you, but he's just a real go-getter. And he's been having like this epigastric discomfort and pain.
Oh no.
while now. And he's had the full workup, GI workup. He's had CT scans, endoscopy, colonoscopy, ultrasounds, all kinds of tests, GI tests, you know, imagine. And everything comes back negative. Everybody tells him that, you know, we don't know why you have this discomfort right here, you know, in your upper abdomen. Um, you know, maybe it's stress. So his wife, you know, when she came with him, she kept telling me that, you know, this is stress. He has two phones going. He doesn't know how to relax. Anyways, long story short, and he did he came and did the neural. I like to do the regular neural, and he felt calmer after the neural, but he was still having this discomfort here. So I had him come and do the stellate, and I usually like to, you know, get in contact with them after a few days, but bear in mind, sometimes it can take a couple of weeks. For me, it took a couple of weeks before I noticed, and it was a very subtle change for me. But so I contacted him afterwards, and he told me, nah, it's still there. And then I saw him about 2 weeks ago, or maybe 10 days ago. And I said, how are you feeling? And he goes, I think it helped. I'm feeling better. So it took him a minute, but he's actually feeling better, and he's actually on the schedule to come and do the other side. Because
how long was that? A couple of weeks out, you said?
Yeah, it was about
okay.
2 weeks.
2 weeks out.
After the treatment that
Excellent.
it took him a minute, but I also have him on some supplements for stress, some adrenal support and a few other supplements. And, we've tried to change the diet a little bit.
Right.
That's kind of my approach, is a very holistic, everything.
Absolutely.
So sometimes it takes a minute to, so you can't just, don't expect instant results.
Yeah.
So that's been my experience. I started doing the stellate ganglion injections in my clinic just last summer, and I have the specialist come every month, and we do anywhere from 3 to 5, sometimes more, stellate ganglion blocks on patients. So we've been able to help a good number of patients. It's a very safe procedure. Because it's done under ultrasound guidance.
Mm-hmm.
We put in all the precautions. We put in IV access just in case. We have the oxygen. So we have, everything set up, in case there's a problem. The doctor that comes and does it with me, he's done over 3,000, and he trains other doctors. He's trained doctors at the VA to do this. And so he's a national expert, and soon I'm going to be able to fly my wings and do it on my own. Let me see if there's anything else that I can tell you. So the stellate ganglion block has been studied in many other conditions.
Mm-hmm.
So chronic regional pain syndrome. From this condition. So so there are many, many conditions, especially people with fatigue, because what we don't realize is that when we are in a constant state of fight or flight and anxiety, we don't realize that we're draining our adrenals. And when you end up in adrenal burnout, you have fatigue. So this treatment can just really help with fatigue, anxiety, insomnia, like I said, chronic pain. It's definitely that I recommend a lot, because I don't know if it's, my practice is holistic, but I end up seeing a lot of patients that have stress. So, important for doctors to be able to pick up on the fact that, their patients are dealing with a lot of stress in their lives, and that this kind of a treatment could, because it's not a, you know, a pill that you're popping every day. You're just, it's a reset of your autonomic nervous system, and it's trying to just help you live a more, you know, natural, more fuller
Yeah.
life, and realize that the way you were existing was
Right.
not a natural state. So I'll open it up to questions, and you tell us your experience.
Yeah, thanks, Karima. So let's kind of recap here just for the people listening. So number one, it targets the stellate ganglion, which transfers those stress fibers up to the brain, right? If
Stress.
is as Karima said, everyone here, especially in California, we're all stuck in a chronic sympathetic fight or flight state, right? And that can be a contributing factor to so many different kinds of symptoms. A lot of people are dealing with post-traumatic stress disorder, and they don't even know it, right? I failed that test miserably, by the way. I took that questionnaire, and I was showing signs of just chronic stress buildup. So the injection essentially blocks those chronic sympathetic stress overloads to the brain, and it just really takes the edge off of all that just stimulus that's just stressing people out. You know, people are stuck in that state. This injection helps to calm that down tremendously. So here's what I noticed right away. You said you noticed the effects settle in maybe over time, even a couple weeks out. I noticed a difference right away. I mean, I'll never forget when you did that injection there. Immediately, I felt just like the whole room just calmed down, became more clear, fuller. I could focus better. I felt like I was at rest. I was sleeping, but I was awake. And even since then, I still have felt just the edge of stress kind of taken off. I feel more clear. And I actually feel the results still settling in. So it's just kind of helped slow me down a bit. I've only gotten one, and I want to do the other side eventually as well. But man, if you're dealing with chronic anxiety, depression, PTSD, chronic distress, this is a great way to help take the edge off of that stress without getting loaded up on drugs and medications, which is just so rampant today. So I wholeheartedly recommend it. I had phenomenal results. The results are still settling in. I've already sent you, a handful of patients and more to come. But I had two questions. Number one, what exactly is in it, right? So you talked about the procaine and the longer lasting anesthetic. What exactly is in it? And the number two, what are the side effects noticed? And of course, the benefits far outweigh the side effects. But what do you typically see, right? And the side effects I had went away within 3 or 4 hours. Not too bad. I still worked the full day. I was good. So what exactly is in it? And then the side effects, and then just a closing statement.
Okay, so
Yeah.
Ropivacaine is a long-acting anesthetic,
Protein.
and again, let me reiterate, Ropivacaine. We want the long-acting anesthetic because we want to shut down those signals for 8 hours. Because if you shut those signals down for 8 hours, then you're allowing this reset, this rebalancing of the parasympathetic with the sympathetic. So Ropivacaine, long-acting anesthetic.
Propivacaine.
The procaine is a short-acting, and that's what I use in the regular neural therapy.
Okay.
So the Ropi will, by blocking the stellate, you are going to get some typical side effects which are desired. So these are desired side effects. So, and it's called the Horner's syndrome. So the pupil gets smaller. So we immediately look for these side effects, where if I'm doing the right-sided stellate block, I'm going to look for the pupil to get smaller compared to the left side. So we have a small pupil. The eyelid is going to get droopy. The eye itself is going to get red. And And then you could have that right-sided sinus congestion. So sometimes you can have a sinus headache. You might notice numbness in the face. You might feel a flushing on that side of the face. You might get a little hoarseness of the voice. And sometimes just a slight difficulty swallowing. We don't really people not to do liquids or not to eat, but just sort of watch yourself and just see if you're feeling comfortable, then go ahead and drink and eat and do whatever you need to do. Some people, they have a little bit of a harder time because their anxiety is so ingrained in them. It's so part of their nervous system that they get scared with any of these little symptoms. Even a little bit of a symptom in the throat, they panic. That, oh my gosh, I can't swallow. Oh my gosh, I can't breathe, or something like that. But generally, we tell patients that these are the desired side effects. We want to see that eyelid droop. We want to see that pupil get smaller, the eyeball get red. And that's called a Horner syndrome. And that it can last up to 8 hours. The first couple of times I did it, for me, it especially the second time, it kind of like knocked me out. Like I had to kind of just take it easy for about 30 minutes. Was sort of, I needed to just close my eyes and take a nap. But now when I do it, I've done it about 7 times. It's like no biggie, like you. I can go about my day. I can continue seeing patients. It's just no biggie anymore, but you still get that benefit, that mellowing out. And like you said, it kind of slows you down, but in a nice way. It makes you more efficient because you're not trying to do things while being anxious. You're getting things done without the anxiety, and you just get more done. And you're feeling so much better, and you're feeling natural, and that's the way you should be. It's like a meditative state where you're present. And when you're anxious, and you're in this fight or flight mode, and all of us in Southern California, or just living in the West, we are in this mode and we don't even know it. So this injection just kind of slows everything down for you and helps you to be present, because when you're in that fight or flight mode, you're not present and you're not really living life to the fullest. So this is an opportunity for you to live life to the fullest.
That's right. Yeah, absolutely. Well, I noticed the positive benefits right away. I'm a huge believer in what you do, Doc, and I really appreciate you taking the time to share all this invaluable information. So again, the stellate injection, incredible, as well as neural therapy. Dr. Hirani, what's the best way for patients to reach you there? Is there an office number? And what city are you located in?
Okay, I'm in Culver City. The practice is called Hirani Wellness.
Hirani Wellness.
They can reach me through the website, Dr. Hirani, HIRANI.com, or they can call my office. I don't have a live person answering the phone, thanks to COVID. And I kind of like it this way. Patients, prospective patients, leave me a message, and I'm very quick about calling you back, usually the same day. 310-559-6634.
Great. Thank you so much, Karima. Always a joy having you on and connecting. Hope you have a great day. Thank you. Yeah.
So much.
Of course. Yeah. And we'll be in touch soon. Again, this is Dr. Karima Hirani. Everyone listening, definitely give her a call. And if you need help, this is wonderful. Have a great day, everyone. And Dr. Hirani, thank you so much for being on the show. Talk to you soon.
Thank you. Thank you, Taylor.
Bye-bye.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.